For more, we are now joined by Cleo Sokhela, who's the Chief Programs Officer at Shout It Now. Cleo, thank you so much for your time. A very good evening to you. So Shout It Now is a community-based organization that is focused on youth health services as well as a primary focus on sexual and reproductive health. Do you think we're winning the fight against HIV and AIDS, particularly when it comes to the young people of South Africa?
Good evening to you and good evening to the listeners. There is a lot of possibility of winning HIV in South Africa with the new innovations of LEN and other choices of HIV prevention. But mostly, we need to prevent. Biomedical interventions alone cannot stop HIV. We need to prevent the contributing factors and the drivers of HIV and AIDS, which is gender-based violence, poverty, and inequality in South Africa.
I mean, you're speaking about prevention being at the forefront of us ensuring that we are fighting against HIV and AIDS, and just considering the remarkable progress that we've made so far, particularly when it comes to the 95, 95, 95 targets. What specific milestones do you believe that would be most significant markers for the success that we have with regards to our HIV response so far?
Yeah, technology. Integrating technology in our service delivery platforms is key, especially in the healthcare sector if we want to reach young people where they are. So it's not a luxury anymore, but it is a need that we need to integrate technology, but also to invest in domestic funding for these programs to integrate young people, especially in this decision making and policy, and to integrate community to lead these interventions. So really integrating innovations like Self-Staff, which is a national adopted AI tool for young people, where it reaches young people where they are. It's safe environment and safe information. So that's what I will advocate for, really integrating technology and adopting that.
And as you speak of technology, you also touched on just that funding and sustainability that we need to look into. We know the current situation with the US having pulled out of a lot of that PEPFAR funding, and the minister now saying that we need to also look across to the private sector for them to assist. What domestic strategies do you think we need to employ in order for us to win on that funding strategy?
So South Africa has got capacity. I think South Africa has got capacity to be able to carry the HIV program in South Africa forward. Definitely, we cannot lose the whole work that we have done. It cannot go to drain. We have the biggest HIV program in the country. We need leadership. We need accountability. We need all hands on deck, and government cannot do it alone. But also we need to be accountable, and we need to hear the voices of young people. As I've said, the drivers of HIV cannot be solved by biomedical interventions. So as much as we adopt these biomedical interventions and really welcome them in the country, we also want the government that is going to advocate for pricing of these innovations. I mean, a lot of trials are done in South Africa and other African countries. Therefore, equity in terms of distribution and policy and approving of these medical innovations in South Africa becomes key. So we really need leadership and funding within the country, because we know that we have capacity in South Africa to fund our healthcare system.
And you've mentioned quite a number of times that we can't only rely on the emerging technologies in order for us to prevent HIV and AIDS. Do you think we have slowed down on the awareness and the educating of HIV and AIDS, and has this impacted with regards to new infections?
Yeah, the truth of the matter is that even with the drop of funding in all countries, I mean, around the world, you know, the component of HIV prevention is the one that have suffered the most in terms of donor funding, international donors. So not much attention is paid into there. I think we have dropped a ball a little bit in terms of messaging, social behavioral change messaging, and really addressing stigma in our families, in our communities, in our churches, in our school, and in campuses. Because if I can say I have HIV, then the next thing that you are very stigmatized by your own family. So it starts in the family. So those are very, very important for us to really eradicate HIV in terms of prevention, but also safe information where young people are able to voice out and get that information. And this is what these AI tools bring. Young people today can go to the social media, can go on Google and access any information of any kind. But having this medical chatbots that are informed by our health policy and are really informed by good policies to consume by young people, it's the key to prevention for HIV.
Yeah, it certainly is. It is that key. And I think even beyond the pulling of funding in the most recent times, if we think back 10, 15 years ago, a lot of the messaging really was out there with every second TV ad. Every second pamphlet that you picked up on the street was really just talking to educating young people with regards to the stigma, with regards to the ABCs of HIV and AIDS. Do you think that the young people of today are exposed to as much information and education with regards to HIV and AIDS that would sort of shift their own mentality when it comes to the virus?
Yeah, I think they have, but you need the tools that acceptable to young people. Young people are on their phones 24/7, and the most affordable part is WhatsApp, which is these tools are not even costly for them. But the traditional method of printing long letters of things for young people to read, it's not really moving as innovation is moving in this new world. Young people have co-created these tools. They are saying, Sis Cleo, can you please make them audio? I just want to listen. I'll listen better than reading. So really, as we move with innovation, we also move with our healthcare system.
And moving with that healthcare system, I think one of the biggest things is access, Cleo. I mean, for a lot of people beyond the urban areas, we really need to look into the access for people, particularly those in the rural areas, when it comes to healthcare, and just given just those persistent inequalities, especially amongst young adolescent girls and women. What do you think are the systemic changes that we need to make and that would be necessary for us to ensure that equitable access to prevention, to testing, as well as those treatment services that are needed?
Yeah, young people in rural areas are really mostly left behind because a lot of pilots and innovations sometimes are in the urban areas, but the tools like this, integrated with local radio slots, integrated with the social behavioral change, integrated with the mobile clinics, that goes beyond that just the urban. The clinics go to the communities and meet young people where they are, at campuses, in schools. So that really creates an innovation where we don't wait for young people to come to our facility or to hospitals because they are definitely not sick. But what are we doing? We want them to prevent them from being sick from the first place. So we must have strategies and innovations that can reach them where they are. So these models, school health, clinics being accessible to young people where they are free, confident, and feel safe. It's much because we also had in our health system attitudes. It's a big issue for young people to access help.
And throughout this conversation, you've been speaking about SBCs, that social behavioral change. And there was that 6-year program, Dreams, that really targeted young people. Maybe just talk to us about some of those successes and what lessons we can take out of such a program.
Yeah, we thank the global funders and the US government for that program. Very comprehensive program that looked at mental health, HIV, integrated social behavioral change, really bringing men to be allies of the HIV and driving gender-based violence. So comprehensively looking at a young person beyond contraceptive, beyond HIV, but making sure that there's an economic strengthening piece that is built within that program. So it also provided age-appropriate health and sexual health information. As young people, we know in South Africa that HIV is not only for the 15 to 8, but we have young people that due to all sorts of things that happens to them can contract HIV. But that information, if it reads a young person 10 years old, at a most palatable way to know about what does it mean when someone touches me like that, and. So that program really was a success. And I just want to say it's not the end of it. In South Africa, we're going to soldier on, and it will live again. There's so much gains that it has brought into our country.
Most certainly. Cleo, I've got about 10 seconds left. I really want to know, from your perspective, what an ideal, fully integrated, innovation-led prevention and treatment system would look like for South Africa.
I think an innovation that is co-created by the users and the people that are using it, young people, people living with HIV, that integrates communities, not only experts, but also let's make health accessible to our people, especially our young people. Innovations that will reach people where they are, not waiting times. Safe platforms for young people where they can voice and access not only to information, but access to health is a problem in our country. We want an empowered rural young person, LGBTQI+, also to be integrated in this program. That's where we'll see the success of South Africa. You save your young people, you save your country.
All right. Cleo, thank you so much for your time and the work that Shout It Now does, especially in ensuring that young people are educated and have that access. Thank you for joining us on this World AIDS Day. All right, we'll have